Good morning, everybody, and welcome to today's in-service. Today we're going to be discussing three topics: informed consent, confidentiality, and advanced directives. Now, as stated in Susan Westbrook's book, Legal and Ethical Issues in Healthcare, she covers several key points in each topic. We'll begin with confidentiality. The first point that she discusses is when we have patient care documents. We should use cover sheets to cover them so that they're not accessible or viewable to other people. Secondly, we should make sure that we destroy any patient care documents, medication packages. A lot of times they come up from pharmacy and they have the patient's label in a bag that has the medication in it. And we should make sure that we need to make sure that we dispose of those in the proper bins. Also, be mindful of when we're discussing patient information, treatments, things like that, diagnoses, and be mindful of our surroundings. We never know who's around the corner and who's listening. Public areas like elevators, hallways, stairwells, those are not really appropriate areas to be discussing protected health information, so we need to be also mindful of who's around in those areas. A lot of times patients will give permission for family members to have access to their information via telephone, and it's always a good idea to use some type of possibly a password that the patient has set up and given to the family member so that we can identify the person on the other end of the line, because we don't always know who is on the other line. So we have to be really careful about protecting patient information. And we can use other things like social security numbers or like the last four digits of birth date, things like that. And then the next thing is we need to make sure that we secure our workstations. A lot of times, if you're in a hurry, we have a tendency to get up from your workstation, and we're thereby leaving our patient care, our electronic medical records accessible to other people. Things like email also need to be secured. Personal electronic devices such as cell phones that are able to have email and that have protected health information should also be encrypted, and that's usually done by the IT department. And then lastly, for confidentiality, we should review our policies in a periodic time frame to ensure that we are compliant with HIPAA regulations. Moving on to informed consent, for Texas, this falls under the Texas Health and Safety Code, Title 4, Subtitle F, Chapter 313, under consent to medical treatment. And this outlines the statutes regarding informed consent and access to medical treatment. In addition, JCO, the Joint Commission, also has accrediting standards that hospitals have to follow in order to be accredited by the Joint Commission. Also, the Patient's Bill of Rights states that patients have the right to make informed decisions regarding their health care. And then they should also be informed of things like risks and benefits of the procedure or the treatment or the medication. In addition, the risks and benefits to refusing those treatments or medications, and they also should have voluntary consent. In other words, a patient should not be under the influence of any type of alcohol, drug, or anything like that, and they also should not be coerced into providing informed consent. The patient or family member must be competent to give that consent as well. Now, those informed consent is usually given by a family member or a patient who is of age to a medical procedure. However, in an emergency situation, informed consent is not necessary, but we have to make sure that that procedure or treatment is necessary and will prevent it'll prevent injury or death. And this usually pertains to patients who are unconscious. Maybe somebody's not available to sign for that patient, and so in that sense, under emergency situations, the physician usually will have informed consent, emergency consent that way. In addition, religion should patients' religious practices should be observed, and they have the right to refuse treatment based on their religious practices. And as nurses, we should honor that. Minors are, in most states, are defined as persons under 18 years of age. However, you can have emancipated minors who, through the court system, are under 18 but are legally designated as an adult. However, in most states, minors can still consent to a few things without the permission of a parent or guardian over the age of 18. And those usually include things like STDs, pregnancy testing, mental health screening, and also substance abuse screening. Now we're going to move on to advanced directives. Advanced directives include things like living wills, durable medical power of attorney for health care, as well as DNRs. And so with living wills, these are documents that are prepared in advance by a capable person who anticipate if something goes wrong, or if there's an accident, or the patient has a stroke or something like that, then we as providers, medical providers, know what the patient's wishes are based on the living will. The durable power of attorney for healthcare, this usually entails a person, a competent adult, who has a proxy that they designate to make decisions for them in case the patient becomes incapacitated for a medical reason, or if they're deemed to be in an unconscious state permanently, and so the proxy can make those decisions based on the patient's wishes. And lastly, we have DNRs, or do not resuscitate. Generally, these are they give information to providers on what the patient's wishes are if the patient should have a sudden cardiac or respiratory arrest. And finally, nurses should educate patients on living wills, DNRs, and those avenues available to them to make those decisions. And they should also communicate with family members, physicians, and patients regarding the information contained in those documents. And lastly, the nurse should document their interaction with the patient and what was discussed, or what was the final outcome of the decisions made for those documents. Okay, and so that brings the end to our in-service, and we want to thank you all for attending. Thank you.